Hey everybody, welcome back to my channel. It is your mental health therapist Toya, and today I am back to talk to you about anxiety. And anxiety is a common diagnosis that I often treat and practice, and I can say it's often undiagnosed as well. I believe we all can experience some form of anxiety at some point of our life. So I want to start off by giving you the definition of anxiety, what anxiety is. And anxiety is basically an uneasy feeling, worrying about something. Sometimes it can be about a certain situation, or sometimes it can just be the fear of the unknown. But anxiety is a worry about something. General anxiety disorder is actually classified as excessive, uncontrollable worrying that people have for a minimum of at least 6 months on end. And it's followed by some of these symptoms I'm about to name. A person can feel really restless, keyed up, or like they're always on the edge. They can feel very fatigued or very tired, have concentration issues, feel really irritable, muscle tension, or maybe even sleep disturbance. To be considered general anxiety disorder, it has to fall under those guidelines. But a person can experience anxiety without having a full-blown panic disorder or anxiety disorder, and that's what we're here to talk about a little bit. So let's talk a little bit about what a panic attack is, because if you experience anxiety, it could lead to a panic attack, but it doesn't necessarily mean you're going to have a panic attack. So a panic attack is a sudden episode of fear and discomfort, and it's followed by a handful of symptoms that a person can experience. Most of these symptoms are physiological symptoms. Some of these symptoms are cognitive symptoms, and I'm about to give you that list as well. A person that's having a panic attack can experience numbness, tingling, shaking, or trembling sensations, some parts of their body. They can feel very lightheaded or get dizzy, have changes in their breathing. Some people describe it as a choking sensation or just difficulty breathing. They can have an increased heart rate, abdominal distress or stomach pains. They can experience sweating, hot flashes, or the opposite. Some people feel really cold or get like little chill sensations when they're having a panic attack. And people describe when they're having a panic attack, some people describe it as having like an out-of-body experience, like they are having a fear of losing control or not being in control. And panic attacks can be common for some people. Now I want to talk to you a little bit about an anxiety attack, because a panic attack and an anxiety attack is a little bit different, or I should say really it's one significant difference that separate the two. An anxiety attack is much like a panic attack, where it's a sudden episode of fear followed by physical discomforts, and the physical symptoms of an anxiety attack can be the same as well. Everything from the breathing changes to the increased heart to the abdominal distress, feeling dizzy, all of those, the same list I mentioned earlier. The key difference between the two, the way I like to describe it, is that a panic attack, the manifestation of those physical symptoms are so severe that it stops you in your track, almost debilitating, to where you're not going to continue driving a car or delivering a speech if you're having a full-blown panic attack. Where an anxiety attack can still have the manifestation of those physical symptoms, but they're not so intense to where they stop you from performing. They may hinder, slow down, or somehow cause you to modify the way you are performing, but you can still drive a car, you can still deliver that speech, you can still perform while experiencing those symptoms of anxiety. So that's the key difference between a panic attack and an anxiety attack. One stops you in your track, otherwise you can look at it as debilitating. You can't continue functioning until the manifestation of those physical symptoms start to subside. Versus anxiety attack, you're still functioning to some degree, to some level, although you're experiencing those physical symptoms. Now, panic attacks and heart attacks can be very similar in symptoms, sometimes even identical. So if you're ever experiencing a sudden episode of chest pain, be it if you're being treated for anxiety or not, I do highly recommend that you seek medical attention. When you go to the doctor, the ER, or the urgent care, they'll be able to perform a test to see if you're indeed having a heart attack. If you go to the ER, the physician will be able to test your blood to look for certain heart muscle enzymes, and if they're not present, then that's an indication that you're most likely having a panic attack versus a heart attack. Now, depending on the severity, the duration, and the type of anxiety that you're having, treatment can include medication, therapy, or a combination of the two. I do always encourage people to seek out a mental health therapist if you feel like you're having anxiety, because it's always good to learn skills to be able to regulate that anxiety. And CBT, cognitive behavioral therapy, is a really good treatment modality to use when regulating anxiety and trying to control panic attacks. Now, I am going to leave you with some tips today of things that you can do if you ever experience yourself having a panic attack or an anxiety attack. One thing that you can do is use what we like to call the 5, 4, 3, 2, 1 method. If you're having a panic attack, first thing you want to do is look for 5 different objects that's right there in the room wherever you're at. It don't matter if you're in your home or outside in public, just look for 5 distinct objects that you can focus on for a few seconds. Think about each object that you're looking at. Color, shape, size. Just put your attention on that object and try to do that at least 5 different times with 5 different objects. Next, you want to listen for 4 distinct sounds. And as you're listening to these sounds or listening for these sounds, you want to be able to really pay attention to them and see if you can tell where they're coming from, how the first sound might have been different from the second, which might have been different from the third, all the way up to the 4th sound that you're going to be listening for. Number 3 is touch 3 objects. And when you touch each object, you're trying to focus on everything from the temperature of that object to if that object is rough or smooth, the texture of that object. And you're really just focusing on each object that you touch, making any observations that you can based off of what you feel. Number 2, try to see if you can pick up on 2 different smells in the area where you're at. Now that can be anything from smelling your own wrist if you wear perfume, to maybe smelling your hair if you have conditioner, to if there's a scent or smell in the air that you can pick up on. If you're outside, can you smell the grass? If you're inside, can you smell any candles or incense, or if you just cooked food? But just trying to pick up on 2 different scents that you can focus your attention on. And number 1, see if there's anything that you can taste. Now this can be something that you might be able to put in your mouth, like something sour or something sweet, maybe a peppermint, or maybe you brushed your teeth. I hope you brushed your teeth that morning. See if you can get a taste of any toothpaste that might still be in your mouth. Depending on the time of the day, you might still can taste some toothpaste. Or see, if you're chewing gum, the flavor of the gum. Or if you already ate, see if you can pick up on any flavors that might be left over from your breakfast, lunch, or dinner. So just see if you can, it's just one. Just see if you can taste one particular taste, wherever that may come from. Be it if it's something you decide to eat at that moment, or something that you're trying to, see if there's still a taste in your mouth from what you ate earlier. And again, that method is known as the 5, 4, 3, 2, 1 method. A great distraction to help alleviate some of those anxiety and panic symptoms that you may have. Other coping skills that might be able to help you alleviate the symptoms of that panic or anxiety attack would be visualizing a peaceful place. Close your eyes and let your mind take you somewhere that's very calming and soothing. It might be a place that you've already been, or it might be a place that you just kind of make up in your mind that is, again, relaxing, soothing, calming, tranquil for you. You can also take deep breaths. I'll do another video shortly that I'll post that'll show you how to properly deep breathe in order to achieve relaxation. You can feel it physically in your body, as well as it's a good cognitive break from whatever it is that you were previously focusing on. But just to give you a general sense of how to do it, you want to take a deep breath in through your nose. Once you suck up all of that oxygen and you can't breathe in anymore, you want to blow that out of your mouth. Nice controlled pace for both inhale and exhales. And then, of course, remembering certain mantras or affirmations or scriptures can help. One of my favorite ones is "This too shall pass." And you can just repeat that over and over again. This too shall pass. This too shall pass. And 1 Peter 5 and 7, cast all of your anxieties upon him because he cares for you. So when I use that, I say, I'm going to cast all of my anxieties upon God because he cares for me. I'm going to cast all of my anxieties upon God because he cares for me. So affirmations, scriptures, things that if you hear it, once you say it, it helps calms you down. That'll be really good to use to help alleviate some anxiety and panic symptoms as well. So I hope you have enjoyed this video, learned a little something about anxiety. Most importantly, maybe learned something specifically you can use to help control or minimize anxiety. It don't matter the intensity of your anxiety. Be it if it's a 10 out of 10, which means the worst you have ever experienced anxiety, which might be that full-blown panic or anxiety attack, or even if it's like a 2 or a 3 out of 10. Maybe you're going in for that interview, or maybe you are about to give a presentation. You know, anxiety symptoms might not be so strong to where it shows, but sometimes we can still feel that anxiety, although we put on a cool, collected, you know, demeanor for others. So being able to remember your deep breathing, your affirmations, your scriptures, or the 5-4-3-2-1 method can really help minimize those symptoms of anxiety. I hope this video has helped you. If so, please share it with someone that it can also help and bless them as well. Don't forget to hit the subscribe button and like this video, and stay blessed until we meet again.